At the center of a storm, the search for a proven coronavirus treatment. Taking an experimental drug can be worse than taking nothing at all, warns Dr. Andrei Khalil. You're treating emotion. Dr. Khalil, 54, is a principal investigator in the federal government's clinical trial of drugs that may treat the coronavirus. Dr. Khalil, who has decades of experience grappling with questions about the use and misuse of experimental drugs, has rarely been more frustrated. These drugs have been tested in the laboratory against many viruses, SARS and MERS, both coronaviruses, as well as HIV, dengue, Ebola, chikungunya and influenza. That is not to say the drugs won't help patients with the coronavirus, only that whether this is so is unknown. Remdesivir, made by Gilead, was chosen to be the first treatment evaluated in the federal effort after investigators did a careful search for drugs that might be effective. The drug also was tested in animals infected with MERS and SARS, both caused by coronaviruses. It is even possible that taking the drug may hasten patients' deaths. Although remdesivir is not approved for treatment of any illness, Gilead provided the drug to COVID-19 patients under legal exceptions for compassionate use. But demand escalated to such an extent that the company announced last month that it would stop giving out the antiviral. The problem is not just that an experimental drug may not work or may endanger patients. If a COVID-19 patient takes remdesivir or chloroquine and dies, did the drug fail? If the patient survives, was it because of the drug? Without a controlled trial, there's no good answer, and no way to compare patients once the drug is handed out routinely. The trial Dr. Khalil leads is not the only one testing remdesivir against the coronavirus. In the usual clinical trial, one drug is tested against a control substance, placebo or the standard of care drug, for a set period of time. Researchers start by comparing an experimental drug, in this case, remdesivir, to the placebo. If patients taking remdesivir are faring better than those taking the placebo, the study will move on to a second phase in which another drug is tested against remdesivir, which becomes the trial's control.